Thanks for taking time to view this presentation on the causes, factors, severity, as well as social work, community, and policy perspectives on prescription opioid use disorder among Operation Enduring Freedom and Operation Iraqi Freedom veterans. A prescription opioid analgesic is the medical term for prescription painkillers. Analgesics reduce pain. Opioids are synthetic versions of naturally occurring opiates like heroin and include Vicodin, OxyContin, and Demerol. Opioid analgesics are the strongest and most effective pain reducers yet developed. Symptoms of abuse include drowsiness, nausea, and lack of coordination. In addition to these symptoms, a diagnosis includes taking others' medication, not following the doctor's guidelines, and taking prescription opioids to get high. Among the general population, prescription drug use disorders have caused a sharp rise in overdoses and deaths. Prescription opioid analgesics have become the biggest offenders due to their highly addictive qualities. Of all 36,450 drug overdoses in 2008, prescription opioid analgesics were the cause of 14,800 deaths. This chart illustrates that over a decade, prescription opioid analgesic overdose deaths surpassed even those from illegal drugs like cocaine and heroin. A 2008 study of OEF, OIF veterans with chronic non-cancer pain, known as CNCP, at VA clinics revealed that about 2/3 were prescribed opioids during a year and further 1/3 on a longer-term basis. 2% of active duty service members self-reported prescription drug misuse in 2002, rising to 11% in 2008. It's important to note that the stress, rigor, and culture of the military have resulted in a long history of substance use disorders. But Middle East deployments have been especially harsh on the body, with over 3.8 million prescription painkillers prescribed by military physicians in 2009, a more than 400% increase from 2001. Take a look at the lowest category, any prescription drug misuse, to view the jump from 2002 to 2008. Now let's discuss the literature for each causative factor of prescription opioid use disorder among OEF, OIF veterans. PTSD, or post-traumatic stress disorder, is strongly correlated with increased risk of receiving opioid prescriptions for pain, with high-risk opioid use, and for poor clinical outcomes. According to the Substance Abuse and Mental Health Services Administration in 2012, some of the most problematic substances of abuse in PTSD are opioids. PTSD itself is a mental response to an extremely disturbing experience. Its diagnosis requires 1 month or more of experiencing details of the traumatic event, avoiding situations, topics, or people, and general sympathetic nervous system arousal such as difficulty sleeping. Chronic non-cancer pain, or CNCP, is a defining characteristic of OEF, OIF veterans and a huge causative factor for the prescription of opioid analgesics. Technology has enabled development of weapons such as IEDs and roadside bombs that result in extreme trauma, but advances in field medicine have put some of these soldiers right back into battle. To keep going despite the pain, prescription opioids are simply the most effective drug for pain management, both on the battlefield and at home. Pain management also helps soldiers heal more quickly, preparing them for multiple deployments. This chart illustrates the use of hydrocodone for immediate and long-term CNCP management. Note that short-acting opioids like hydrocodone tend to be more addictive. Comorbidities are the presence of one or more co-occurring disorders. In addition to PTSD, OEF, OIF veterans have shown the presence of many additional mental health disorders, including depression, alcohol use, and drug use disorders that complicate their treatment and can lead to prescription opioid use disorder. From 2002 to 2008, mental health diagnoses for veterans entering VA healthcare rose to 36.9%, or 106,726 individuals, with 29% receiving dual diagnoses and others with 3 or more. Reintegrating into civilian life is a huge stressor for any veteran, especially those who have experienced highly traumatic events. Shame over having killed, feeling misunderstood, PTSD and all of its complications, and substance use habits picked up during combat are all factors. Some have called the tragic outcomes of reintegration for this group of veterans as a public health crisis. Reintegration challenges are exacerbated by returning to a low-income area, such as those in certain parts of New York City. Lacking social, family, and friend supports, and already being surrounded by drugs, joblessness, and violence, veterans in this scenario have experienced drug use disorder at high rates. The problems for them are prescription opioid analgesics, cigarettes, and heroin. A study concluded that substance use disorders, service-connected disability, pathological gambling, and personality disorders represent the strongest modifiable correlates of homelessness for veterans. Substance use disorders combined with mental illness are so debilitating that they result in homelessness among some veterans with enough income for their own housing. Finally, in a program for homeless veterans, OEF, OIF participation increased from 1.4% in 2005 to 3.5% in 2008. Of those, 35.1% were more likely to have PTSD, itself a strong predictor of prescription substance use disorder. TRICARE, established to serve the health needs of service members and their families, has done a poor job at addressing mental health challenges, including prescription substance use disorders for OEF, OIF veterans. Only 42% of these veterans use TRICARE as of September 2008. The active Guard and reservists who served are not eligible. Distance from care facilities is often prohibitive, and many young veterans are not comfortable with VA care environments. Regarding substance use disorders, TRICARE does not provide for many outpatient services. It doesn't cover some evidence-based pharmacological treatments, and it doesn't cover long-term use of addiction medicines. Surprisingly, doctors and nurses within the VA system don't always manage prescription opioids with other drugs in a professional manner. A particular drug combination, sedative hypnotics such as benzodiazepines like Xanax, along with prescription opioids, can cause overdose and death, as well as rapid dependence. Further, all medical evidence has shown that benzodiazepines should be avoided in those with PTSD, as it actually worsens the symptoms of PTSD. In military culture, toughness is paramount. Seeking help for mental health issues, already a societal stigma, is especially difficult for veterans. Exacerbating this reality is the fact that confidentiality is not guaranteed. Especially for active duty military personnel, careers can be harmed because their records have typically been open. Many are calling for massive changes within the Department of Defense, from educating veterans about mental health to increasing confidentiality to civilian levels for all military personnel and veterans. Here is my conception of the web of causation for prescription opioid use disorder among Operation Enduring Freedom and Operation Iraqi Freedom veterans. A social work perspective that I appreciated was one that demands cultural competence for social workers by engaging with the OEF, OIF veteran population. By researching and learning about the lived experiences of this population, both from trainings and from veterans themselves, social workers can help save lives. It's important to note that suicide rates for active duty soldiers are now the highest they've been in the military's 26 years of record keeping. This model places the burden on social workers to adapt to OEF, OIF veterans and learn their culture, as they have needs unique from any previous veteran population due to harsh conditions, long tours of duty, multiple deployments, and severe physical and psychological scars. Social workers have a duty to possess a deep understanding of PTSD and its challenges, and to understand that, mentally, reintegration is similar to the process of immigrating to the U.S. from a foreign country. One very promising approach is the North Shore LIJ Northport VA Unified Behavioral Health Center for military veterans and their families. It's a public-private collaborative model, and it's one of many recent pilot programs with investment from the VA. It opened its doors in October 2012 to target behavioral health needs of veterans and their families. The program's goal is to facilitate seamless access to mental health services for military veterans and their families, where professionals meet face-to-face to collaborate on solutions for both populations. Upon entering the joint facility, family members receive health services at North Shore LIJ, while veterans receive separate services in the Northport VA wing. Coordinators and families then come together in a central conference room, using crosstalk methods to best serve both veterans and their families. Official analyses of this project began in January of 2014. From a policy perspective, much of the action on this issue, including the community initiative described above or prior, has been driven by an executive order issued by President Obama called Improving Access to Mental Health Services for Veterans, Service Members, and Military Families. The order was issued on August 31, 2012, and promised copious federal funding to serve more than 2 million service members deployed to Iraq or Afghanistan since September 11, 2001. By expanding suicide prevention strategies, improving partnerships between the VA and community health services, expanding VA mental health staff, investing in more research and development, and establishing a mental health interagency task force, the federal government intends to meet current and future demand for mental health and substance abuse treatment services for veterans, service members, and their families. In conclusion, prescription opioid use disorder is now at a crisis point for OEF, OIF veterans. This population faces unique mental health challenges due to extreme physical and mental trauma not seen in prior combat situations. Suicide rates have skyrocketed, demanding swift and creative action. Two defining factors of these veterans, chronic non-cancer pain and PTSD, are treated primarily with drugs, setting the stage for prescription drug use disorders. The executive order in 2012 is a huge turning point, but it will require strategic, thoughtful implementation using evidence-based practice if it is to help change the course of this crisis.